My name is Piper Pearson, and as a resident of Beaufort County, South Carolina, I've chosen to present on health obstacles facing those residing in communities within rural areas of our beautiful state. Beaufort County is a growing coastal rural region with approximately 187,000 residents. Of these, about 12.5% identify as Hispanic or Latino, which is a proxy indicator for rural and migrant populations. 14.7% identify as Black or African American, while the rest of the population identifies primarily as white. There are major disparities in the county between the coastal, tourism centric areas and the inland agricultural zones. The goal of this presentation is to highlight health barriers faced by underserved rural communities in Beaufort County while tying them to relevant Healthy People 2030 objectives. As many South Carolinians know, housing is a huge concern for our area, and it's no different in Beaufort County. Many renters and homeowners spend more than 30% of their income on housing and utilities across the United States, which qualifies as a cost burden. In the Beaufort and Jasper County area, many renters are severely cost burdened and paying over 50%, which forces trade offs on essentials such as food, healthcare, or transportation. Many rural homes in Beaufort County also have at least one major deficiency, such as incomplete plumbing or kitchen facilities, overcrowding, or inadequate maintenance. Some homes are simply old and lack necessary repairs, making the living conditions unsafe or unhealthy. There's also very few rental units in good repair that rent for less than what many low income families can manage, as well as being within access to transit, accessible roads, grocery stores, employment, or healthcare. In Beaufort County, another issue comes from vulnerable populations such as seasonal workers, military relocations, and the Gullah Geechee communities that experience issues like rising property taxes and land loss that affect stability among an already historically marginalized group. It's important to note that while areas of coastal tourism thrive, rural areas with higher migrant and minority populations remain underserved. Many of these areas are considered food deserts with little to no access to foods other than offerings at convenience stores. Healthcare for emergency situations is also inconvenient or inaccessible at all for many. These issues, along with social isolation, language gaps, and immigration worries, deter individuals from seeking healthcare, even for critical issues. Ultimately, this means physical concerns and hazards intertwine with chronic health conditions due to poor nutrition and living conditions, which ultimately impacts mental health well being as well. This all aligns with the goals of Healthy People 2030, improving access for at risk rural populations by leveraging voucher programs and expanding healthcare clinics in rural areas, reducing injuries and exposures through better training and access to safety equipment in agricultural settings, promoting mental health care through culturally sensitive outreach, stigma reduction, and telehealth support, as well as continued support for and expansion of culturally aware strategies and coalitions like T4BC, as well as support by state and federal programs, can make meaningful progress towards Healthy People 2030 targets for those at risk in rural populations. So, what is T4BC? Together for Beaufort County is a coalition model working on health, prenatal care, mental health access, and service coordination. Since its implementation, there have been notable improvements. For example, in prenatal care alone, rates in Beaufort County now rank among the highest in state health outcomes. The South Carolina Migrant Health Voucher Program facilitates culturally and linguistically competent care for migrant workers, a rapidly growing population within the county. They focus on targeting immigrants who may not otherwise seek out assistance due to language barriers or other immigration related fears to provide necessary support for access to food and other resources. These are just a few examples, and a lot of challenges still persist. Beaufort County still faces clinic and specialist shortages, higher average costs of living than both the national and state averages, as well as transportation limitations.